Hi guys, we're here to talk to you about chest tube placements, what they're used for, and what the procedures look like. Points to keep in mind when chest tubes are in use. The overall goal of chest tube therapy is to improve breathing and oxygenation, restore lung expansion, and prevent the reoccurrence of further complications. We hope our video gives you a better understanding of what occurs and can ease some anxiety for you and your family. Thank you.
So the first thing that they're going to talk to you about is going to be the function of your lungs. So, and basically what that is when you breathe in, you're taking oxygen in. When you breathe out, you're blowing out CO2. And we have what is going to be referred to as negative pressure in our lungs. And all that basically means is as you breathe in, your chest wall cavity, when the diaphragm pulls down, it acts like suction. So it keeps those lungs nice and inflated and allowing you to take that nice deep breath. Okay, so when you have an issue with that space, whether it be air, which comes from an injury, or extra fluid, it will disrupt that pressure, that negative pressure, and it will collapse your lung down. So that lung is almost like a deflated balloon, and you know, once it gets wet, you can't really re-inflate it. So it just kind of sticks there, which compromises your ability to take in oxygen and have all the things that your body needs.
There are a few things that can result in needing a chest tube. The basis, there's either fluid or air in the pleural space between the lungs and the muscle. Air in the pleural space could be what is from what we call a pneumothorax. This is when the negative pressure system that is ruined in one or both of the lung cavities. The lung cannot fill with air. A traumatic injury, like being stabbed in the lung or the pleural cavity, could possibly let in blood to the pleural space. Pus, lymph fluids, and also other things can also build up after surgery, or perhaps an abscess rupturing can also cause this. Signs that could show that you're having an issue in the pleural space is having sudden onset of shortness of breath and difficulty breathing, severe chest pain, and possibly unequal chest rise. The medical staff will observe the signs and symptoms reported along with your vital signs. If the situation is not dire, they may try to have a chest x-ray or a CT scan done to confirm this.
It's about inserting the chest tube. Your provider is going to start by having you sign a consent form, which in this time you shouldn't be afraid to ask any questions. It's going to help ease further anxieties, and your family might have questions, so they should be in the loop as well. You're going to be asked to lie on your back, your side, or your side with one arm over your head. They might even have you sitting up in bed leaning forward onto a table if you're able to. A medication is injected to help numb the area. You may possibly have sedation as well, but after that a small cut is made where the chest tube is going to be placed, and the tube is placed and guided in between the ribs until it's in the pleural space between the lung and the muscle lining. You may have an ultrasound to make sure that it's in the right spot. The provider will place stitches in your skin around the tube to hold it into place, and there will be sterile gauze placed around the base of the tube where it attaches to the skin to keep it clean and dry.
So how will we know when it's time for this chest tube to come out? When the pleural space that we mentioned earlier is emptied, the chest tube will be removed. And changes that show that this is emptied is improved respiratory status, so you're breathing a lot better, and your chest is rising equally when you're breathing. The process can be done right in your bed with some more pain medication, and you'll be instructed to take a deep breath and hold it, or to possibly bear down, and this is going to make sure that no air re-enters this area while they're removing that tube. The provider may stitch it closed, or they could leave it to close on its own, but either way there will be bandages placed over it. So healing. How long does it take to heal? Possibly 3 to 4 weeks once the chest tube has been removed. It kind of depends on what else you have going on. And it's important that while this is healing, you make sure to keep the site clean and dry to prevent any infection. The doctor will also remove the cover after about 2 days just to check the site. So when we talk about the gauze and checking the site, this is the chest tube drainage system, and this is how we measure how much is coming out of that space, and this is the end that's inserted, and the gauze will be around it in a little square, and taped off to cover that area.
So there are certain things your nurse is going to be looking for when it comes to possible complications that you may experience. She's going to be looking for any signs of bleeding or infection, and most of the time this is going to include bright red blood in the dressing, or an odor that doesn't smell quite right, or the drainage or dressing being yellow or brown and covered in pus. These are signs of infections that we can watch for and monitor and treat as they occur. So she's also going to be looking and assessing you for any sort of swelling of the neck or the face or the chest, and this may be due to air accumulating under the skin. If you suddenly have any chest pain or shortness of breath, this is one of those things that you have to let your nurse know as soon as it occurs. If you notice or you move and the chest tube comes out, this is a rare complication, but let your nurse know immediately.
So some common questions and concerns that we've already touched on, but we're going to just go back through one more time so you really fully grasp what we're talking about. A common question is this permanent? No, it is not. It's going to be in until that injury or that fluid is healed, drained, and gone. Is it going to hurt? They are going to, like we said, they're going to use lidocaine, which is to numb it, and they're possibly going to use sedation, so you're going to be not completely aware of what is going on. Can you disconnect the device? The answer is no. Nobody in your family, not you, nobody but your provider or your nurse is to touch the device, where it's hooked, where it enters your body. Nobody touches that, as it can be detrimental to your recovery. I hope this answers any concerns or questions that you have.